Hi, good evening, and welcome back to this series on professional exams made easy, where we discuss important questions for your university exams. Uh, I think some of the universities, the exams have already started. Some of the universities, we are awaiting exams, which will begin probably from Monday, and in some universities, maybe a little bit later. Uh, Today, we will discuss about couple of topics or couple of sections which are often ignored by the students because the weightage is very less. But let me tell you, these are short questions. These are the questions that we should not miss in the exams, right? So what we'll do today is we'll focus on two important topics which will be asked in your exam. One is ADCOM and the other one is the genetics, right? So first, let's start with ADCOM. ADCOM, we know, stands for Attitude, Ethics, Communication, and 5 modules have been covered in year 1, first MBBS, and questions from these are guaranteed, right? NMC has mandated that paper 1 and paper 2 of this subject should have this module question only, right? So there are not many questions that can be asked from these topics, right? So if you know the competency, if you know these are the possible questions, 5 marks is guaranteed in each paper. So we are talking about like 30 marks from 3 subjects, which is huge, substantial, right? So let's try to understand what are the ADCOM topics from different modules and how these are segregated paper wise. First, what we'll do is we'll focus on questions which can be expected from the topic of anatomy, right? Again, in paper 1 and in paper 2, the topics differ, right? So what we have in paper 1, as I'm describing and explaining this, let me tell you, this is hi Joe. So this is directly from the document of NMC, right? The curriculum document. So anatomy paper 1 will have one short essay of 5 marks, which is from the module 1.5, which is about the cadavers as the first teacher. We will see possible questions, but 5 marks on cadaver, the professional behavior towards the cadaver, how do we handle biomedical waste? This is a top-notch 5 mark question. Okay, so how do we respect the cadaver? How do we follow the correct procedure in handling the cadaver and other biological tissues? How do we manage the biological waste which is produced during the dissection? This will be definitely asked in paper 1. Okay, we will see a few questions. Then in paper 2, it is module 1.4, right? So they're going backwards, starting from paper anatomy paper 1 to biochemistry paper 2, starting from 1.5 till module 1.1. Okay, in anatomy paper 2, the module is 1.4, and again it's on the foundations of communication. The second part comes in your phase 2 MBBS. Here it is part 1 of foundations of communication, which focuses on how to communicate with patients. Then like how to communicate with patients in a patient respectful and non-threatening, non-judgmental and empathetic manner. So it's all about how do we communicate with the patient. Unfortunately, ADCOM module is being assessed by writing, right? Which is not an ideal way of assessing the ADCOM module, but okay, they have found some way of assessing it, and it's to the benefit of the students that like you already know what questions can come, right? So again, 5 marks in paper 2 is from anatomy paper 2, right? So this module 1.4, where they'll ask about the foundations of communication. We will see a few questions which are asked from these topics, right? For example, if you're talking about module 1.5, that is cadaveric oath, right? Or the cadaver as the first teacher. These are the possible type of questions, or these could be the possible questions that can be asked. For example, explain the importance of showing respect while handling human cadavers in anatomy learning. So the question appears vague, non-specific, but you need to structure your answer in AETCOM module. As I said, 5 marks are for the taking, and this is how the questions will be framed. Then the next question could be, possible question could be, describe the correct procedure to be followed when handling cadavers and biological tissues. Fine. End of the class, I'll be sharing notes related to these questions. So please go through these notes and frame your answers accordingly. Right? Then discuss the ethical significance of the statement, the cadaver is our first teacher. Some of these questions I've taken from the past universities as well, right? Past university question papers. How does respectful handling of cadaver contribute to professionalism? Uh, Cadaver as first teacher, how does it relate to building up a practice of professionalism as we progress in medicine, right? That's what the question means. Then, what are the do's and don'ts while working in the dissection hall? The questions look pretty simple, right? And we think that like, okay, let's write anything in the exam. Imagine you write anything non-specific, you end up scoring 2.5 or 3, right? Believe me, we have seen students who have fallen short by 1 mark in each paper, in each subject, right? Remember, 2024 batch will not have grace marks. No matter to which university you belong, there are no grace marks. You can fail by 1 mark in all 3 subjects, right? So please do not neglect these questions, right? 5 marks are for the taking if you prepare for these questions, right? Some of these questions could be case-based. For example, imagine you are a first-year student, you are dissecting the cadaver. One of your batchmate is not showing respect towards the cadaver. How will you handle this situation? What ethical or professional behavior would you explain to your batchmate? Right? This could be the type of questions you might get, but you will get a question on the handling of cadavers and handling of biomedical waste. To all these 5 questions, let me add one more important topic. How do we dispose, right? How do we dispose human or biological waste, right? Now for this, you must know the color coding, right? The color code of different types of dustbins we use in dissection hall and how we dispose the cadaveric waste, how we dispose the scalpel and the sharps, how we dispose the gloves and other tissues. This is what is all about AETCOM module 1.5, right? Then the paper 2 will definitely contain question from module 1.4, which is on part 1 of foundations of communication, where the questions can be framed like this. Explain the importance of empathy in doctor-patient communication. Describe the principles of effective communication between a doctor and a patient. What are the common barriers to patient-centered communication and how they can be overcome, right? Discuss how a non-threatening and a non-judgmental attitude improves doctor-patient relationship. Describe the role-play-based learning as a useful method for teaching communication skills. Justify with examples. All this you might have learned, you might have practiced in your lecture hall. Now it's the time to bring it on the paper. Okay. Apart from this, one more question you can get is on types of communication. Okay. You can get a question on types of communication. Then you can get types on question on types of non-verbal communication. All these possible questions can be asked in this section of foundations of communication, that is part 1. Fine. Here again, you can also expect case-based questions. For example, imagine you are an intern working in the emergency or the casualty, and a patient in emergency is brought in a critical condition. and you have your co-intern or you have a resident doctor who is actually cracking jokes or not communicating with the patient attenders properly. How will you handle this situation? This is how the question will be framed, right? Questions can be direct from these topics or they can be case based or scenario based, fine? So it's better to be prepared for these type of questions too, right? But again, let me tell you, these questions, these topics will definitely come in your paper 1 and paper 2, and you should be in a position to answer these. As I said earlier, we will list few questions that can be asked in AETCOM module. We'll share the notes with you. Please go through these notes before you write your exams. Are we clear? Right. Now, this is regarding what modules are asked in paper 1 and paper 2. Right? Now, apart from this, I know that this will be dealt possibly a little bit in detail in your physio and biochem classes as well. But let me give you an introduction, what possible questions or what possible topics are included in your physiology and biochemistry. Your physiology topic has module 1.2 and module 1.3. So 1.4 and 1.5 both are in anatomy. 1.2 and 1.3 are in physiology. So module 1.2 is about what does it mean to be a patient, right? Where there are two competencies that are involved. One is we need to describe what are the professional qualities and roles of a physician. For example, what we need to know here is the 7 roles of an Indian medical graduate that is expected. Okay. Now, what are these? So we have the role of, just a minute. We have the role of, let's say, the clinician, right? Then an effective communicator, right? Then a leader, then a professional, right? Then a lifelong learner, critical thinker, researcher. So these are the 7 roles that are expected of an Indian medical graduate, that is all of us, right? So these 7 roles or qualities we need to describe, right? Now, module 2, if you 1.2, again, the other question or competency is on how to demonstrate empathy in patient encounters, right? Again, these will be questions, direct questions, or could be case-based or scenario-based. Then in module 1.3, which is asked usually in paper 2, the doctor-patient relationship, that is module 1.3 will be asked. And here again, the professional qualities of roles of a physician and also empathy in patient encounters, right? So module 1.2 and 1.3 is asked in paper 1 and paper 2 in physiology. Similar to this, we have biochemistry where module 1.1 will be asked, right? Here we have only one module, 1.1, both in paper 1 and paper 2, right? So module 1.1 has 4 competencies. In paper 1, you will be asked about 2 of them, okay? These are enumerate and describe the professional qualities and roles of a physician, right? Almost the overlap of what we learned in the last module for physio. Describe and discuss commitment to lifelong learning as an important part of physician growth, right? How you will practice the role of lifelong learner throughout your practice. Questions can be framed like this, okay? Then in biochemistry paper 2, what does it mean to be a doctor? In this, the competency covered include discuss the role of a physician in healthcare system. Again, I'll repeat, it's a must for each one of us to remember the 7 roles of an Indian medical graduate, which is expected. Okay, these only you can list and explain as the 7 roles of a physician, right? Then the physician's role and responsibility to society and the community that he or she serves. Again, I'll tell these questions or these competencies or topics look pretty simple. Okay. And you will think that why waste time on reading these? Believe me, if you're not prepared well with structured answer for these questions, the examiner will just turn the sheet, turn the paper, and give like the same marks for everybody. Okay. So you need to make sure that your answers stand out among the papers which are average, right? To score 4 or 5. How do you do it? You do it by presenting your answers well. Please spend at least half an hour or 1 hour on each of these module. Okay, it is worth spending because you will score those 5 marks definitely. At least put together in both the papers, you will score 8 or 9 out of 10. Please do not neglect. Okay, so as I said, we will share the notes of these questions from anatomy modules. Please go through these question and answers and be prepared for your AETCOM questions from the paper, right? Then the next important section from which we get about let's say 5 to 8 or 8 to 10 marks, right? Most of the universities it's in paper 2, and in some of the universities maybe asked in paper 1, but usually the marks allotted is anywhere between 5 to 10. So you might get like one short essay, one short answer, or one short essay, and let's say 3 MCQs. It depends. It depends on universities. But the weightage is about 8. And again, the topics are limited. It's not like vast, like head and neck or your abdomen and pelvis. So these topics, again, you should not skip, right? General anatomy, right? You should never skip. General embryology, systemic embryology, systemic histology, genetics. These are like limited questions or limited topics which are asked from these sections, right? And these are the sections that you should be well prepared with. Now, what are the questions you can expect from genetics, right? So, as I said, 5 markers mainly. There can be occasional 3 markers, or there can be plenty of MCQs, right? The most frequently asked question from the topic of genetics, let's say, is karyotyping. Okay. You need to define what is karyotyping. Okay. Define what is karyotyping. Describe the procedure in detail. Right. You can use a flow chart. You can use a diagram, but describe the procedure in detail, starting from collection of blood till the photography of the chromosomes, right? Then applications. Where do we use karyotyping, right? So if you can describe karyotyping under 3 settings and describe the procedure in detail, believe me, you will score out of out, like 4.5, 5, it's guaranteed. Then non-disjunction is one question that we often get as either 3 marker or 5 marker, right? So again, we need to define what is non-disjunction, right? Then explain how non-disjunction can occur, right? In meiosis, right? So let's say in meiosis as well as mitosis, right? And then what is the clinical implication of non-disjunction? The chromosomal aberrations, especially numerical aberrations, are because of non-disjunction. Fine. Let me put it this way. Let's imagine there is a question on Down syndrome. How will you write? Right? Down syndrome, as we know, is a genetic disorder. It's a numerical aberration of chromosome characterized by trisomy 21. What do we mean by trisomy 21? There is an extra chromosome in 21st chromosomal pair. So instead of 2 chromosomes, one maternal and one paternal at 21 side, we have 3 chromosomes, and this is what we call as trisomy. How does trisomy result? Trisomy results because of non-disjunction. So you should know what is non-disjunction and how is this different from the anaphase lag. which is one more important 3-marker question. Okay, so not disjunction, as I said, a 3-marker or a 5-marker. NFA slack could be a 3-marker or a 5-marker. Please demonstrate it with the help of a diagram, right? How the chromosomes fail to separate completely. One daughter cell receiving incomplete chromosome or no chromosome at all, the other daughter cell receiving all the components. So this is how you should explain non-disjunction. And again, in non-disjunction, you should end it with clinical implication. Are we clear? Right. Then these 3 questions, take it from me, these are potential 5-marker questions, which can be seen in every alternate question paper in every other university. Down syndrome, Klinefelter syndrome, and Turner syndrome. Right. So we need to define what each syndrome is. Okay. Then let's say we start with what is the definition of the syndrome. We will describe the not phenotype to begin with. What we can do is first we can mention the genotype, right? For example, how do we write it in Down syndrome? Remember, in Down syndrome, what do we have? The trisomy 21. So trisomy 21 is that. If we write about Klinefelter's, let's say 47XXY. In Turner syndrome, let's say we write it as 45XO. So this is how we should write the chromosomal composition, right? This is what I mean by genotype. Then once we discuss genotype, we can talk about the phenotype. What do we mean by phenotype? Here we can mention about the clinical features or the physical appearance. What are the clinical features the patient of these syndromes will present with? Then we can describe the mechanism, right? How does Down syndrome, Klinefelter syndrome, or Turner syndrome can result, right? What is non-disjunction? Explain it with the help of a diagram, right? So this is regarding these 3 questions, which are potential 5-marker questions. Very important. Even in your histology practical, there will be one chart, right, which will be on these syndromes. Okay. Apart from this, Edwards and Patau syndrome, these could be 3-marker questions, right? Use the same headings. Okay. Definition, genotype, phenotype. You need not talk about mechanism here again, right? If it's a 3-marker question, please stick to 3 headings. Define it, mention the genotype first, and then describe the clinical features. List it. This is regarding the most frequently repeated questions. Okay, now all these questions are also important topics for your MCQs as well, right? Edwards syndrome is what? Trisomy 18, trisomy 13, trisomy 21, trisomy 22. Questions will be framed like this. Okay, so this is regarding the most frequently repeated questions. Apart from this, from the topic of genetics, what are the other questions we can get? One is on chromosomes, right? In chromosomes, what are the other questions we will get? Remember, the first short essay, structure of chromosome, is a 5-marker question, right? Then classification of chromosomes, right? Especially Denver's classification, right? Now, if you have any friends from KUHS, just ask them the sort of questions they had got on genetics last year, right? What classification they had asked. It's literally scary, okay? So classification of chromosomes, especially Denver's classification, right? So you should know how it is classified. Then chromosomes belonging to each group, you must be aware of, right? So structure, classification, which is 5 marks again. Then the X chromosome, right? Even this has been asked as a 3-marker question, right? So how does X chromosome look? What is it? What is its structure? Even this could be a very important 3-marker question. And when it comes to X chromosome, one question you cannot do without is the question on bar body, right? Now, what is bar body? It is a sessile body which is the inactivated X chromosome, right? Now, in bar body, what we need to know, what is the definition of bar body? How the bar body is formed? How does it look? What is its significance? How do we calculate the number? Right? Now, usually some of your question papers may have questions on, let's imagine there is a patient with Klinefelter syndrome. Describe the genotype, calculate the number of bar bodies present in this patient. Right? So how do we do it? For example, usually we calculate it by using the formula n minus 1, where n is equal to number of X chromosomes. Right? For example, if we talk about female, how many X chromosomes a female will have? 2, right? 2 minus 1 is equal to 1. So 1 is the number of bar body present in a normal female. Let's talk about the Turner's syndrome. In Turner's syndrome, what is the number of X chromosome present in females? It is 1. 1 minus 1 is equal to 0. So the number of bar bodies present in Turner syndrome is 0. Then what about the Klinefelter syndrome? In Klinefelter syndrome, how many X chromosome do we have? Remember, Klinefelter syndrome is 47XXY. So these are phenotypically males, right? So 2 minus 1 is equal to 1, right? So if there is presence of bar body in a female, in a male, it could be suggestive of this genotype, right? So remember, how to calculate the number of bar bodies is a must for your exams. Are we clear? Right. Then the next thing is regarding chromosomal aberrations. In chromosomal aberrations, there are two. One is numerical aberrations and the other one is structural aberrations. But both of them are 5-marker questions. Explain the numerical aberrations of the chromosomes, where we need to describe about monosomy, polyploidy, trisomy, all of this. These are numerical. Change in the number of chromosomes. In structural aberrations, we can explain what do we mean by deletion, what do we mean by addition, what do we mean by translocation, what are the types of translocation, what do we mean by ring chromosome, what do we mean by isochromosome. All these structural abnormalities are a definite 5-marker. Individual types of structural abnormality could be a 3-marker question. Isochromosome could be 3-marker, right? Then ring chromosome could be 3-marker. Reciprocal translocation could be 3-marker question. Robertsonian translocation could be 3-marker questions. But remember, chromosomal aberrations, both numerical and structural, are important 5-marker questions. You should not skip, right? Then the next thing is regarding the pedigree chart. What is pedigree chart? How do we draw a pedigree chart? What are the symbols used in pedigree chart? These are the things that we should know, right? So pedigree chart, what is it? How to draw? What are the different symbols we use in drawing a pedigree chart? This is a must. Then, when it comes to Mendelian inheritance, we must know about the autosomal dominant and autosomal recessive disorders and X-linked disorders. Most often, the examples for these disorders are asked, okay, which is very common. This you must know. I would suggest know at least 6 names or 6 examples each for autosomal dominant, autosomal recessive disorders, right? And similarly, X-linked disorder, X-linked dominant and X-linked recessive traits, right? So these are the examples of disorders or clinical traits you must know. But apart from this, when it comes to autosomal dominant or autosomal disorder, recessive or X-linked disorder, we should know about the features, right? What are the features of autosomal dominant disorder? How about the mode of transmission, right? Right? And what are the important associations with these genetically inherited disorders? So basically, how the autosomal dominant recessive or X-linked disorders transmit from one generation to one generation, exhibiting various features like pleiotrophy, anticipation, codominance. All of this you must be in a position to explain, right? What I've tried to do is I've tried to arrange the questions in the frequency in which they are usually asked, right? The most frequently repeated questions to possibly lesser asked questions. But how many questions did we list? About like 7 plus 6, about 12 or 13. If you read these 12 or 13 questions, those 8 marks are guaranteed again, right? So please, again, do not neglect this topic. Similar to AETCOM module, I will be sharing the genetics notes as well. Please go through these topics for your exam, right? As I said, AETCOM module in each subject will be for 10 marks. In each paper for 5 marks, in each subject for 10 marks, right? So 30 marks are for the taking and you should not miss it, right? Genetics, 8 marks in anatomy are guaranteed from this. So please prepare well for these topics, right? I know you're preparing very busily for your exam, so I'll not take much time. If there are any doubts related to ADCOM or genetics, please let me know before we close. Okay, Harini, definitely Harini. So Thursday, let's do a session on general anatomy. I think we have already done a session on general anatomy, but we will repeat a session on general anatomy, and probably we'll discuss some of the important questions which are asked in general anatomy, right? We'll do, right? Thursday, because like we are done with most of the topics for your gross anatomy, histology, and embryology. We will definitely do it for general anatomy. Thursday, there will be a session on general anatomy. We'll do it. Right? So thanks again. Study well. Very shortly, we will share a question on. We'll share a small video on like how to prepare for your exams. And I'm really sorry, I totally forgot that this itself is Thursday, right? Uh, Two holidays back to back made me feel that like this is a Monday. Okay, so today is Thursday, and possibly we will do a session very soon. I'll just check with the team and get back how early we can do, because I believe some of the universities, the exams are starting as early as Monday itself, right? So I'll discuss with the team and I'll get back with a tentative date. Let's try to do it before the weekend, and we'll find a slot and we'll do it, right? Thanks again. Thank you very much.